Why does the journey to becoming a doctor seem so arduous? Perhaps it's because the medical field demands a deep understanding of the human body, the skill to perform under pressure, and the compassion to care for those in need. The cornerstone of this demanding journey is the MBBS syllabus, designed to mold the uninitiated into skilled medical professionals. Embarking on the MBBS, or Bachelor of Medicine and Bachelor of Surgery, students dive into a rigorous curriculum spread over 5 to 6 years, depending on the country. This period is a mix of theoretical knowledge and practical exposure, ensuring that by the time students don their white coats, they are well prepared to face the challenges of the medical world. The first year serves as a foundation focusing on the basic sciences. Subjects like anatomy, physiology, and biochemistry are introduced. Anatomy teaches about the structure of the human body, from bones to muscles, giving insights into what lies beneath the skin. Physiology deals with the functioning of these structures, ensuring students understand how the body operates at a systemic level. Biochemistry explores the chemical processes and substances that are vital to human life, linking biology with chemistry in the context of medicine. In the second year, the curriculum builds upon this foundation with subjects such as pathology, microbiology, pharmacology, and forensic medicine. Pathology is the study of diseases, where students learn about the causes and effects of various diseases on the body. Microbiology deals with microorganisms and their effects on humans, critical for understanding infections and disease prevention. Pharmacology introduces the science of drugs and their impact on the body, an essential area for any aspiring doctor. Forensic medicine, meanwhile, provides insights into the legal aspects of medicine. The third year often focuses on consolidating knowledge with subjects like community medicine and continuation of studies in pathology and microbiology. Community medicine is pivotal as it teaches students about health and disease in a population context, preparing them for public health roles. The final years are intensely practical. Students undergo rotations in major areas such as general medicine, general surgery, obstetrics and gynecology, pediatrics, orthopedics, dermatology, psychiatry and anesthesiology. These rotations, often termed as internships or clerkships, provide hands-on experience in various specialties, helping students decide their area of interest for future specialization. Throughout their education, students also learn important skills like communication, ethics and decision-making, which are crucial for effective patient care. The inclusion of these soft skills ensures that graduates are not only competent in their technical knowledge and skills, but are also empathetic practitioners. In summary, the MBBS syllabus is meticulously structured to cover a broad spectrum of medical and surgical knowledge while emphasizing practical skills and ethical medical practice. This comprehensive approach ensures that graduates are well equipped to handle the complexities of healthcare and patient management. The importance of this syllabus cannot be overstated. It is through this detailed and exhaustive training that students transform into professionals capable of saving lives and maintaining health. The journey through the MBBS syllabus is not just about acquiring knowledge, it's about becoming a beacon of hope for those in need. Thus, the role of this curriculum is crucial in shaping not just competent doctors, but also leaders in the medical community who can face health crises with expertise and compassion.